Let's talk Medicare Supplement Plan G versus Medicare Supplement Plan N. This chart behind me has the benefits that are covered in G versus N right next to each other. Right behind me is the column of the different possible dollar gaps in Medicare approved claims. And when you look to G and N, you can see which of the gaps they cover. When you look at the yellow highlighted squares, that's where there are some differences between G and N, and we're going to talk about it. In this video, I'm just going to talk about the one right up here where it says the Medicare Part B coinsurance or co-payment. In this example, we're looking at a 70-year-old female in the Chicago area who has Medicare Supplement Plan G and another one who has Medicare Supplement Plan N. For G, the woman is going to pay $135.12 a month premium, and the woman who has N is going to pay $98.83 a month. So there is a difference of $36.29 a month. You multiply that times 12, that's $435.48 in premium for the year, and the difference between G and N. Now, both of these women they get some sort of a service under Medicare Part B with their doctor, and the bill is $1,226. It's the beginning of the year. Neither of them have met their Part B deductible. Under both G and N, the supplement does not cover that, so the Medicare beneficiary has to pay it. So she has to pay $226, and she has to pay the $226. With the $1,000 remaining, the bill had been submitted to the Centers for Medicare and Medicaid Services. They had processed it, also the $226. They processed this claim. And because the deductible has been met, Medicare is now on the hook for 80% of the bill. And so what happens in column number one, the woman who has Plan G, Medicare pays their $800. The 20% remaining, the $200, is sent to the Supplement Plan G, and their job, as long as it's a Medicare approved claim, is to pay the full 20%, that full $200 in this example. Now, if you look to the second column, Medicare still was on the hook to pay the $800, but now with that $200, this is where you see some difference. So we said with G, the full $200 was covered by the supplement. With N, the Medicare beneficiary, the 70-year-old woman, is going to do some cost sharing. She could pay up to a $20 copay for a Part B service or up to a $50 copay for emergency. So in this scenario, she's going to get a bill where she has to pay $20. The supplement's going to pay $180. So if she took Plan G, she wouldn't pay the copay, but she'd be paying $36.29 more a month. So you look at the math and you decide which way is better for you.